My name is Frank Haney. I'm the Winnebago County Board Chairman. I am joined by the Rockford Mayor, Tom McNamara, Dr. Sandra Martell from the Winnebago County Health Department, and to my immediate right, providing assistance with sign language, is Lee Langish. Winnebago County Emergency Operations Center has been working hard to support the Health Department in responding to this unprecedented public health threat facing our community, the nation, and the world. I'm here today for a couple of reminders before I turn things over to Dr. Martell, and I want to speak to every citizen in Winnebago County because every citizen has a role to play. Number one, stay calm. The reason that you should stay calm is that I believe, and many believe, that we have a great team in place, whether that's first responders, it's public health officials, there's great planning going on. We are in a very good position to serve you over the next several weeks. I'm here today with a very special request, yet again, is to stay apart and respect social distancing. The idea that we are going to stay 6 feet away from one another. The next, of course, is to stay put. Sometimes the best way to help with COVID-19 is to stay home. We need everybody to buy in to that message. Lastly, this idea of staying connected. You can do that in a lot of ways, from reaching out to family and friends, checking on the neighbor, checking in with people via social media. There's a lot of opportunities that this challenge provides to stay connected. We do have a problem, though, and I want to speak directly to that. I'm not going to mince words or pull punches. There is a small segment of our community that is not taking this as seriously as they should. The consequences of that may not directly impact them today, but it could impact one of our first responders, our nursing care workers. It could impact a member of our elderly community in a few weeks. So it is imperative that we understand that we are all in this together. If you are not, to this point, respecting social distancing, staying put, staying apart, we need you to start doing that. It is consequential in that you do have a role to play. I guess an analogy is this, is that we are in Winnebago County, whether you live in Rockford, whether you live on the east or west side, you live up north in Rockton or South Beloit, or you live in New Milford or Cherry Valley, we're all in the same boat. We all have a oar, and we all have a specific role to play in this. Not all of us are the public health administrator like Dr. Martell. Not everybody has the role of a Tom McNamara, the City of Rockford Mayor. Not everybody is going to be the fire chief, but every single citizen of Winnebago County has a very specific, direct, and specific role to play in helping us get through this. This idea that we're in a boat and we're gonna row the boat to get to the other side of this, how fast we get there, how bumpy the water is, and the current, we can help bend the curve, we can have an impact on how this goes. Failure to take this seriously, even by a small segment of our community, is consequential. You need to make sure you're getting your information from very viable sources. The media has done a very good job of pushing out accurate, verified, vetted information. The Winnebago County Health Department, the version of that at the state level, IDPH, and the CDC at the national level, is pushing out accurate, verified information by professional health folks, and that is where you should be getting most of your information. The City of Rockford has been a great partner in that effort as well, and I want to thank their staff for their leadership. Why do we need to buy into this 100%? Because there is a team in the Emergency Operations Center, Mallory Wren and her team, who are doing a great job around the clock, making sure that we're ready to respond as things go forward in the coming days and weeks. But there are healthcare workers, whether that's at a nursing home or at a hospital or a walk-in clinic, that are counting on you to have their back. Normally we talk about our first responders and our frontline workers having our back. They do that all the time. Now it's our turn as citizens to have their back by being proactive, staying apart, and staying put. Do not spend your time trying to work around things that are being asked of you by public health professionals at the local, state, and national level. We need you to be part of this team, and whether we like it or not, we are all in the same boat, and what one person does can affect other people. And we need to row the boat. Everybody has an oar. We all have a role to play. There are corrections officers that are going home to their families and then going back into our local jail the next day. We need their families, like every other family in Winnebago County, my family and your family, to adhere to staying put every chance we can, staying apart every chance we can, so that we don't have things passing around to, again, frontline workers in this community who play a vital role. On a positive note, I'm kind of excited about this. I believe tonight at 8 o'clock, Miles Nielsen, among others, are going to do a live concert. There's a lot of ways to stay connected. I think that's kind of cool. I like Miles' music. So on social media tonight on Facebook, tune into Miles, and this is something that wouldn't be happening. So we have opportunities to make some moments during tough times. Stay connected, and thank you, Miles. That's rowing the boat right there. That is making a difference in a unique way from where you're at. Mayor McNamara is going to talk about some of our business folks and the way they're rowing the boat and making a difference in a very significant way. And that's why we need everybody in our community to be part of this effort. I want to thank Nathan Bryant at the Rockford Area Economic Development Council for working with area manufacturers around specific steps they're taking. I want to thank Nathan and his team. They're definitely rowing the boat. I want to thank, there's a number of our state delegation and our federal delegation who are working very hard, and I want to in particular thank Mayor McNamara for how tirelessly he's working to make sure we're positioned to get the most dollars we can for our community when money is released at the federal and state level. I want to thank Dr. Martell for her leadership, whether that's sending the mayor and I emails at 2 in the morning with updates or her tireless leadership. This matters. We have a very good healthcare system and healthcare team. The Emergency Operations Center is doing everything. We're in a good position here, but we need 100% of our citizens to buy in to social distancing and staying put and following the directives by health professionals. You do that, we will be in a much better position a week or 2 weeks or 3 weeks from now. But if we have a segment of our population who is going to fight that, that will take away energy and resources from where we need to be focused. So we need everybody on board rowing the boat. I do have a couple of Winnebago County updates. In Winnebago County Administration building, there's 3 offices that get the majority of the foot traffic that go in and out of the County Administration building on Elm Street. Our treasurer's office, Sue Goral, is our treasurer. Our recorder, Nancy McPherson, and our county clerk, Lori Gumow, are going to have their staff working tomorrow, but they're going to ask the community, when you have business with the clerk, recorder, or treasurer's office in Winnebago County Administration building, that you call because they are not going to be taking walk-in contact, walk-in service. Why? Because they are doing their very best to row the boat, make a difference, and stay apart and respect social distancing. And that's harder to do so across the counter from just a foot or 2 away. If you have an animal need related to animal services, please check the Winnebago County Animal Services website and Facebook page for some operational changes. They are working, but at the same time there's some operational changes. Please reference there and call before going out as well. Tonight we have a Winnebago County Board meeting, and we will be doing, several of our board members will be calling in to make sure we're doing our part to keep 6 feet apart and also not having more people in a place than is being asked of us by local and state and now national health officials. I just want to emphasize this, and I can't emphasize it enough, is this idea that we are well positioned. We have a great team doing planning and doing the day-to-day work. We have people who are the best in the state at what they do here locally for us. I think we've known that for a long time. Let them do their job, and let's all the rest of us who are not first responders, who are not healthcare workers, who are not working frontline in nursing homes, let's give them the space and also have their back by rowing the boat and staying apart 6 feet, about staying connected in our personal lives with friends and family, and also this idea that when we're asked to do something, it is in no way disrespectful to you as a citizen. It is to protect not just you, but a whole lot of other people in our community. So we need to buy into that. Thank you very much for your time, And with that, I'm going to turn things over to Dr. Martell. Thank you.
Thank you for joining us again today. First of all, I want to start by saying there are no new positive cases in Winnebago County. I know that the governor announced that there were 134 new cases in the past 24 hours throughout the state of Illinois, and announced 3 deaths of Illinois citizens, none in Winnebago County. So I want to be clear that while we continue this, the efforts that everyone is doing on the social distancing have continued to help us flatten that curve. We keep talking about it and we keep working toward it. We have submitted, when people ask me about testing, and I'm going to go right off on this one, we are now at the state of Illinois, testing is being prioritized for people who are being hospitalized with what we call atypical pneumonia, and those individuals that are coming out of what we call congregate living situations, such as jails, nursing homes, congregational living, the homeless shelters, because they are our highest priority in the sense of at risk for coronavirus and COVID-19 and poor outcomes. Other individuals that require testing must first, again, call ahead before you go. You can use telemedicine. The governor announced expansion of reimbursement for telemedicine and telemedicine capabilities so that individuals, if they want to consult with their provider or caregiver, can do that before so that the whole first responder care team can be ready to receive you in that system. Those tests that are being done are sent to our private laboratory systems, such as a LabCorp or a Quest. As of today, we have submitted what we call 38 specimens of people at risk. We continue to report 1 positive. We have 16 negative results have come out of the system, and 24 are pending. 82 are in the LabCorp system, and that's through the work of all our health system partners who are reporting that to us voluntarily on the number they're submitting to private. So we continue to get a sense of what is happening in our community. With that in mind, with the number of cases increasing, we have begun to expand our social distancing and mitigation recommendations. So now we are limiting crowd groups of gatherings to no more than 10. We are reducing from 25 to 10 and maintaining that 6 feet of social distancing. Now, people will ask, does that apply to me? It does not apply to businesses. It does not apply to daycares, which are still operational, but daycares are not accepting new enrolled children. Why? Because we talked about that earlier in the week, keeping their cohort together. They are not to be an alternative to school care. We talk about some of our businesses. They are able to maintain that 6 feet of social distancing on their footprint within that space. But as we go through this, we're going to continue to put and heighten those standards so that we can ensure that we are maximizing what we call those social mitigation strategies so we can help the community stay as safe as possible. Over the week, we had a lot of calls, I'm going to call it about personal care, barbers, hairdressers, body art establishments, massage, nail salons. We are asking that they suspend services. Why? Because they can't maintain 6 feet of social distancing as part of their routine service. They must get within a certain level of space to be able to perform the services they provide at the high level that they do. We know that this is going to be difficult for individuals. We understand, but we have to continue to enforce and begin that process of really encourage that social distancing so that we don't place the establishments at risk and the people they serve at risk. So that's the next step on all of this. Daycare centers will continue with providing care, especially to our first responders. We want our healthcare workers to be able to provide the care that they need, but they will not be taking new enrollments. Across the nation, elective surgeries, including all our 3 hospital partners, have agreed to delay or suspend elective surgeries and procedures so that they can begin to conserve the supplies, the equipment, and reserve for staffing to be able to care as the disease of COVID-19 begins to expand in the community. We want our systems to know that we are behind them to help prepare. They continue to provide testing, but again, call, seek your medical care provider guidance before. You may be instructed, even with symptoms, to stay home if you have a mild case and recover at home, and only seek medical care from an emergency department if your symptoms worsen or become severe that you need emergency care. We cannot emphasize that enough. We've got to make sure that we support our healthcare system so that they are able to conserve both resources to provide care to individuals most at need. I want to thank the community so far that has really done a tremendous job to help us in addressing these concerns and issues. They have been maintaining social distancing. They've been calling and asking questions about how can they make their environment safer. We understand this is a very difficult and stressful time for all. We want you to know that we are backing you up. Our healthcare systems are ready to care for those most critically ill that need the care and support, and to test those who require testing. But we need everyone, if you get nothing else, but call first before you come. Use your telemedicine. They will advise you appropriately. If it's an emergency, you will then be taken through the emergency system process. Help our healthcare providers conserve the resources they need to be able to provide care to the most critically ill. If you have questions, we still want to remind the public to call the Illinois Department of Public Health hotline at 1-800-889-3931. And again, for specific questions to Winnebago County, which many of our community members are calling and asking, should I be able to do this? Can I do this? What do you think about that? We have it from our Emergency Operations Center, which is that big team behind me, way more than 6 feet away from me, that's backing us up and really helping to answer all those questions. Their number is 815-319-6705, and they're available Monday through Friday from 9 to 5. So again, I want to reconfirm, there are no new cases in Winnebago County. We continue to see a number of cases in Illinois increase, and we continue to ask our community to monitor the situation and to comply with the directives of social distancing, keeping group sizes down to 10, and following up with medical advice from their providers should they become ill while at home. Thank you. And next I'm going to turn it over to Mayor McNamara for our City of Rockford comments.
Thank you, Dr. Martell and Chairman Haney. I just want to say the teamwork and collaboration that I've had the opportunity to experience with both of you and the teams that you bring is really phenomenal. I think that's one of the best things that I can say that's come out of this really difficult time is to see we do have the best people and they're all working together. From the healthcare companies to government to nonprofits to local citizens stepping up and doing amazing work. So these are obviously incredibly difficult times throughout the city of Rockford, the state, and the country. Dr. Martell has just announced increased restrictions for groups gathering, and those increased restrictions also came with a number of other businesses asking to suspend their operations. So this is a terribly difficult time for our businesses as well as their employees. At the city, we're continuing to get creative with opportunities to help small businesses. One of those opportunities that we're working with and is recapitalizing the Northern Illinois Community Development Corporation Fund to help those businesses impacted by the response of COVID-19. Recapitalizing this fund is an effort through the Rockford Local Development Corporation, the City of Rockford, and Winnebago County, as well as a number of local banks. Don't think that tape lasted. Also, an effort of a number of local banks in our area who are stepping up to provide funds to provide low-interest loans to businesses who are struggling at this time. At the City of Rockford, beginning this Friday morning through April 6th, we are limiting visitors to City Hall to only those visitors who have appointments in advance. These are incredibly challenging times for our community. I just want to stress, remaining calm and being prepared has served us well to this point, and it will continue to serve all of us well if we remain calm and we continue to just prepare ourselves, as all of our partner agencies have. I urge all of our fellow citizens to continue to be calm and just be prepared in your own homes. I'm asking that each one of you stay inside, practice social distancing, and take care of yourself, take care of your family, and check on your senior elderly neighbors. This is, as Dr. Martell said, we can help flatten the curve, and I believe we have had some impact on what the virus has done to our community based on our strong measures, and if we can continue to do that, it bodes well for all citizens of Rockford. But I do have to say, in the midst of really challenging times in the city of Rockford, people come together. And it's really remarkable, the work that individuals and corporations are doing. And I just want to take a second and highlight some of the work that's being done. Number one, the Rock River Valley Blood Center is in need of donations. And we are already seeing people step up and donating blood during this difficult time. I'm urging all citizens who are able to consider donating blood to the Rock River Valley Blood Center. Secondly, Grantview Distillery is suspending their normal operations and is going to begin producing its own hand sanitizer solution for us. That's remarkable that a business is totally changing their model to help us all out during this difficult time. Supply Corps, a major logistics and supply chain company here in Rockford that typically and often you'll see supplying abroad, is going to help us here locally with supplies that are needed. That's wonderful, and they're continuing to be a great corporate citizen. PCI Pharmaceutical, one of the larger employers in our area, are also there to help us with supplies that our community and first responders need. We are hearing from people, we are hearing from nonprofits, we are hearing from companies all across our region asking how can they help. These are the kind of offers and actions that, quite honestly, just are not surprising to me. This is truly the kind of community that we are. This is who Rockford is. We come together during these difficult times to help one another, and now we're coming together to ensure that all of us are healthy. I'm asking that you please continue to take care of your neighbors and that you continue to monitor the elderly. I do want to say one thing to employers in our community. You are obviously under incredible pressure right now. We understand that. I'm asking that you please do every single thing that you can to protect your employees' health from exposure. Please give your employees, if they're working at this time, the equipment and the tools and the space that's needed to do their work. Continue to practice social distancing. And one of the last things I'll say is information. Chairman Haney mentioned this. I think I've mentioned it at every single press briefing we've had. It is imperative that you get your information as citizens of Rockford from reliable sources. This is imperative because it, quite honestly, and just being real with the citizens of Rockford, if you're pushing inaccurate information, you are wasting our time. All of us need to respond to this information. We need to dispel myths, and you can do a big part for the citizens of Rockford and the health of our community by just publishing accurate information from reliable sources. So, again, let's stay calm. We are prepared, and we all are asking you, stay inside. I want you to take care of yourself and take care of your family, and know that all of us are going to make it through this when we work together, because we are prepared to serve all of you. And I'll bring Dr. Martell up for questions.
Questions? Mayor, can I get, given what's going on in San Francisco, and I believe tonight at midnight, the suburb, Chicago suburb of Oak Park will issue a shelter-in-place order, essentially commanding people to stay home with the exception of doctors, pharmacies, grocery store runs. Is that something the city is considering, or do you think is that something that is being considered more at the statewide level? Or have you heard any such discussions?
So, as I said at our last press briefing, I thought restrictions would continue to get stronger. I still believe that they'll continue to get stronger. Today, they just got stronger with limiting gatherings of 10. I will say that we have the power, if there's an imminent threat to our community, to do a shelter in place. Right now, we are not exercising that option, and I will say, Ken, I really think if we were to exercise that option, it would need to be a county or regional approach to have a lasting impact and be as effective as possible. If just the city of Rockford did it, it would not be as effective. But it certainly, I'll just say, I think we've all said this. Every single tool is on the table. And I'll just reiterate, every one of these restrictions, they're terribly difficult, they're terribly disruptive, but no one benefits. Government doesn't benefit. The only people who benefit is the health of citizens in our area. So each one of them, we weigh all the information that's coming in, we process that information, and we do what everyone should do. We listen to the professionals. We listen to reliable information and experts like Dr. Martell, and I have full faith in the work that Dr. Martell and her team are doing, and we are in direct communication with the state, as you mentioned, but right now, I think the process that we're going, you're seeing us limit exposure. I think you'll continue to see us work to limit exposure, so we hope that no one in our community has to die because of the virus.
Regarding businesses, Mayor, and the hardships they're going through, you mentioned low-interest loan availability. I think the governor today mentioned sales tax deferrals for a couple of months. Is that something the city is considering?
Yeah, so we're just being upfront with you, we are considering everything to help small businesses. The low-interest loans that we're working towards, I also have a request into the state asking them to match any dollars we raise here locally to double our efforts. Again, every single thing is on the table, and many of which depend on how long this carries through. So yes, everything's on the table to ensure that we help small businesses and make sure that we are fighting aggressively for their employees.
One last question for you, Mr. Mayor. We mentioned that these are unprecedented times, and telling businesses that they need to close their doors is something that's also unprecedented. So I guess with unprecedented times, is there any sort of discipline that is thought of for businesses that aren't heeding those warnings and closing their doors?
So I'll say this. We've been really, I won't even say we've been fortunate. Rockford's done a wonderful job, and I think our county's done a wonderful job to heed the direction of professionals, by and large. Those that do not heed our direction, yes, we'll certainly enforce it. We're not playing games. This is life or death for many people, and the health of our citizens is paramount. We're going to do absolutely every single thing we can to limit our exposure and make sure that our citizens have the best opportunity, so when we're on the other side of this, that all of them are as healthy as possible.
Mayor, you mentioned, and all have mentioned, the limiting of the size of the groups to 10. There's been a confusion when it comes to places of worship. Can you kind of clarify that? Churches, mosques, synagogues? What's the directive?
I'll allow Dr. Martell to explain it, but I will say I certainly understand the importance of faith. There's a tremendous importance of faith to so many people in our community. Again, these restrictions aren't put in place willy-nilly. These restrictions are put in place for the health and the safety of our citizens, which I know all faith organizations care paramount for. I ask that they do suspend their services. There are opportunities, I'll let Dr. Martell go into the details, but I really do think they need to suspend their services at this time. It's not going to be for a long period of time in the totality of things. But right now, we know one of the best things we can do is limit gatherings of people, which limit the exposure, which allows us to flatten the trend. So that's what we need to do, and that's what we need to do all together.
And I echo the sentiments. There's nothing, I'm going to say, nothing mystical or magical about a faith-based versus another gathering of 10. We encourage them to use alternate methods to engage their faith-based community, whether it's prayer chain, whether it's video church. But we really have to get to this point where we really need to get those gatherings down. And we also know that many of our individuals that attend faith-based services might be our most vulnerable. And so that is an important thing to concept for everyone to understand, is that this is a group that really we need to help encourage and promote that they also stay put and not make it out, because they're most vulnerable and most at risk. So we need that word out.
Dr. Martell, can you go over those numbers again? You said
Sure.
every day 38 specimens have been taken.
Okay.
Can you break that down again?
All right, we call them, and every day we talk about the PUI, persons under investigation. These are individuals that meet the screening criteria set by the Illinois Department of Public Health with risk factor. To date, we have submitted 38 PUIs. We've had 1 positive, 16 negative, and 21 are pending. Now, pending means they typically come out in 24 to, right now we're pushing out to 72 hours. So those, for the most part, those 21 that are pending were submitted in the last 2 days. And then there are 82 specimens in the LabCorp in the private sector. Now, could we have missed a few in there? Yes, because we're asking our local hospital partners and systems to report to us, our FQHCs, to give us a count at the end of the day of how many they've submitted that we at the health department don't authorize for risk criteria. And those are 82. We understand right now from those systems that it takes about 5 to 7 days for those results to come back out. So you can understand why the state system is emphasizing those most at risk, because we want those results out as quickly as possible, so that if there is a case in a congregate living situation, that we can respond promptly to be able to make sure that all the other residents in that congregate setting are tested along with the staff to make sure that they are protected. So that becomes an important concept as we move through this. You see the state prioritizing those individuals at risk in that, what we call the PUI category, and then others can get tested through the private lab system.
And so that's a total of over
82
100?
pending or 82
Okay.
that have been tested?
No. Let's go back over this, and we can put that in a table at some point. 38 PUI, those are people that meet investigatory criteria from the Illinois Department of Public Health and the CDC for testing. So they have some significant risk factors that meet the eligibility. Of those, 1 was positive, 16 are negative, and 21 of those 38 are pending. Is that
And so
clear?
altogether, it's over.
Oh, no, it's okay. And then the 82 are at LabCorp, and those are all pending. We've not seen any results come back out, because those were submitted at the beginning of the week. It takes 5 to 7 days for those results to come back out. So we would not expect those out till sometime early of next week. We'll begin getting some results reported out.
Those are all area people, though they're not under you guys.
Correct.
So for the one that was positive, it was a community spread. How is there just one? Is there just no one else has been tested? Is there?
That wouldn't be accurate, because you've heard other people are being tested. Again, community transmission, again, identifies that we don't know how this person contracted it. They did not meet any of the risk categories, but remember, they did meet the clinical picture. We explained that when we reported the positive, they met the clinical picture for testing. So what we're seeing is that we continue to monitor, again, look at the criteria. The new emphasis on the criteria are people in congregate settings with pneumonia that are hospitalized, so that we're able to take a look at that. So that does not mean, as you see these number of cases ramping up, 134 new ones in the past 24 hours, they're looking at community transmission throughout the state.
How is the person who tested positive doing in Winnebago County?
At this point, that's protected health information, and we cannot disclose.
How many
You guys
tests does?
don't have to go to a meeting, they do have.
Oh, yeah, apologies, we have a 4 o'clock liaison call.
How many tests are in the Winnebago County Health Department? Do you guys have a number on how many you have?
Okay, just to be clear, we have no tests. The test kits and the ability to test, first of all, the test reagents are at the Illinois Department of Public Health Lab and LabCorp and Quest and other labs throughout the country that are certified to do that test. The test kits themselves are swabs and viral transport media that all healthcare providers routinely have in their system to be able to test for other respiratory viral pathogens. So I'm not sure what your question So we have
the
no...
testing kits, do you guys have like a supply of them that you use or ration out? How does
No. Each system has their own testing medium supplies on a regular basis. And typically with a contract lab like LabCorp, you request the supplies and they turn them back as you submit specimens.
Okay.
It's time, guys, do you need to get to your meeting? I apologize for the short question session.
Can we ask Chairman Haney or Mayor anything? I have a quick one for Chairman Haney. So
Yes.
you mentioned the three, it was the clerk's office. What were the three that are closed to visitors, basically? Clerk's, treasurers, I couldn't remember.
Yeah, so there's 3 offices in the Winnebago County Administration Building that have by far the most foot traffic, if not almost all of the foot traffic. Our treasurer's office, our county clerk's office, and our recorder's office. So they will, effective tomorrow, they're asking that you do not walk into the building to obtain service, that they will have people working, but to call their office. Thank you. Any other questions?
Do you have the power to issue a shelter in place, or would that fall on the mayor, or can you both do it?
No, at this time, that is not something that we are talking about.
Regarding city council meetings, does that mean no audience will be permitted at city council meetings?
So, first, I'll just give you a quick rundown of our schedule right now, because, so, we had a council meeting this past Monday. What we did is we took out the front row of seats, then we spaced out the chairs, and then we also hooked up the television down in the lobby and spaced out chairs. What we are prepared to do, we also spaced out aldermen and department heads and limited the total number that could be in there. What we are prepared to do, if necessary, is have telephonic council meetings so that we can have aldermen call in, have our department heads call in, and we'll have very few people actually in council chambers. It would be myself, maybe the legal director and the clerk, and we would conduct it still in that same room, but all the aldermen and many of the department heads would phone in. It is my understanding that the public could still participate. They could either come physically and participate, and is probably more likely the way that they would participate. Right now, so we had a meeting this Monday. Next Monday's was just going to be committees. We've postponed that. The following week was a strategic planning session. We have postponed that. So right now, the next scheduled meetings would be April 6th, and that would be a long evening for us. That would be all committees and council the same evening.
I just want to clarify who has, I'm not asking.
So I don't have it for the county, I have it for the city of Rockford. So I could do it for the city of Rockford, but
I guess.
well, what it would look like, I guess, at this point is not necessary to talk about, because we, at this point, we have not moved forward with, I would say, pulling that. It would be very similar to what the state would do or what Oak Park has done if we would ever consider that. But we're not quite there yet. We're monitoring the situation. Dr. Martel's done a phenomenal job of making sure that we are putting in restrictions in place to help reduce exposure for citizens and flatten that curve.
Thank you.
Thank you.
Thank you.
Appreciate it. Thanks for all your work. Thank you, Kate.